everyone, we're going to learn how to do an SHG tray today. I have with me Nicole, and this is Laura. Laura actually works in X-ray, but she is an expert in putting these trays together. She's put them together 1,000 times for us to help us out, so she's going to show us how we do it. The first things you're going to need is an HSG SHG tray pack, a catheter, and you will need a saline bag. You will need a 60 cc syringe, and can you grab the light? Once your radiologist comes in the room, you will need a light. I would always check your light first to make sure it turns on and that it actually works. All right, so we're gonna let Laura take over here and show us how to put it together. We got her sterile gloves here so she can keep everything sterile. She is gonna use a dummy tray for us today so that we're not wasting.
Okay, so the catheter comes separate from the tray. Put that over there. So you're gonna open your tray and use your sterile technique away from you, both sides, and then towards you. The tray comes with everything you need and a lot of stuff you don't need. So it's a process of keeping stuff and throwing stuff away. After you get your tray open, you want to drop your catheter. Pretend I'm doing this sterile. Check the balloon on it, make sure the balloon inflates. You can take this yellow part off if you want. You want to make sure it inflates and stays inflated. So you push the syringe, make sure the balloon stays inflated. If it doesn't, get a new catheter. So we keep the catheter. Pretend I'm sterile. This is a fake tray. Get your sterile gloves on, pretend I'm sterile. We keep these. We go on the left side of the tray. Keep both of the sponges just like this at the bottom of the tray. Tubing, pink needle. I don't need a 20, right?
No, we don't need the 20.
You don't need the 20. Throw that away. Keep both packets of the lube, the gauze, all 3 Q-tips, 1 pack of betadine. The other pack is trash. This little thing is trash. Keep the small tray. It's where your betadine's gonna go. This one is trash. Speculum, big paper towel, and a pad. This is trash. So the first thing, is open the speculum. It's gonna come closed like this. Just open it on the perforation. Make sure the speculum is closed. If it's open like this one is, push up and push down. That'll close it up. After that, you're gonna open both packs of the lube, spread it on the tip of the speculum. Make sure it's nice and lubey for the doctor. And then that just lives on the gauze. These get thrown away when you're done. Next, you wanna open the tubing and this end goes onto the catheter, just like that. And then, where's the 60? Oh, it's over here. The pink needle goes onto the 60. Are we actually drawing it?
You don't have to.
Okay. Well, you going to? Okay, don't poke me. So you want to make sure that you're not forcing the needle into the saline bag. It should just easily go in. Draw the whole syringe of saline. Pull it out. There should be a cap on here, but I broke it off. So cap your needle, take it off, and attach Then you always want to prime your catheter to make sure that there's no air in the catheter. So you want to prime until you can see it coming out of the tip, like so.
That's going to prevent all the air bubbles from being inside their uterus, preventing you from being able to see.
You open this up. It's really big for no reason, but just cover it up like that. Pad goes on top, and that's an SHG tray.
Now,
Just for future note, you can put this over your patient if you don't have a sheet to put over their knees, right where the doctor is sitting on a stool, right at the end of the table. And for note of reference, Dr. Chan does not like anything attached to the catheter when he inserts it. I think it makes it difficult because it's kind of weighty with this on the table. So just undo that so he can put that on, and he'll reattach it to the catheter.
the other thing is, if you have never done one of these, what'll happen is they'll insert, before they insert the speculum, the radiologist will hold up the end towards you. All they want at that point is that you're going to insert the flashlight so that they have light to be able to see. So I usually just keep it in my pocket ready to go.
And please clean it when you're done.
Yes, please do. So as far as prep for before you're going to do a SHG, you're going to do a regular pelvic ultrasound. Go show your radiologist, because you never know what you're going to find before you even start. Then I usually go ahead and do a consent form. X-ray will have those consent forms. On the consent form, I will put their G and P, gravida and parity. I will put their LMP. I will put their pregnancy test results. Again, X-ray has the pregnancy test that you can do for these patients. And then I will put any surgeries that they have had down and the reason that they are getting it. All of that will be on there for the radiologist to see when they come in to do their procedure. And that should be it. I kind of tell the patients they're probably going to cramp during this because we're putting fluid into a space that normally doesn't have a lot of fluid. And that when they are done, I tell them what goes in has to come out. That's why we're going to give them the pad. 1, because the betadine might stay in their underwear, and 2, because that fluid has to leak out. If you have any questions, please feel free to contact us. We will answer anything we can for you. They're really not that hard. They're more scary the first time you do them, but then once you do one, you realize they're really not that hard to do. Thanks. See y'all later.
Good luck.